Hello, good day. Let me introduce myself as I am applying for the position of a nurse in your company. So let's begin. I am Maria Romain Tungul, 39 years of age. I'm a registered nurse in the Philippines and also in the Saudi Arabia. I have a background in healthcare as a nurse, having 17 years of experience. I worked as a nurse in General Hospital in Philippines for 1.5 years and also in the Saudi Arabia as an outpatient nurse and cord blood staff nurse. First, let me answer the following question with regarding to me. So first, what is my motivation and interest to pursue my career? So I was motivated to pursue a career in healthcare, especially as a nurse, because I have a genuine passion for helping others and making a positive impact on people's lives. I'm interested in this position because it allows me to combine my knowledge and skills with my desire to contribute to the standard of care and improve patient outcome and to help sick people. Also, I pursue this career in healthcare STEM for my desire to make a positive impact on people's lives. I've always had a passion for helping others and being there for them during their most vulnerable moments. So, nursing allows me to provide compassionate care, support, and comfort to patients and their families. It's incredibly rewarding to see the difference I can make in someone's health and well-being. In terms of why I am interested in this position, it's because nursing gives me the opportunity to combine my passion for healthcare with my love for connecting with people. I enjoy building relationship with patients, advocating for their needs, and being a part of collaborative team that works together to provide the best possible care. And it's challenging yet fulfilling for me as a nurse that allows me to continuously learn and grow. Number two question, how do I stay current with latest healthcare trends and technologies? For me, as a nurse, I stay current with the latest healthcare trends, technologies, and best practices by actively engaging in continuous learning. I regularly read research articles and participate in professional development activities. This will help me to stay up to date and ensure that I can provide the best possible care to patients. And the hospital I worked before was using the latest technologies, so at least I have some knowledge with regards to the newly used technologies nowadays. Other helps also by reading nursing journals and publication, attending conferences and seminars, and taking online courses, following healthcare blogs and social media accounts. Number 3 is what are the example of challenging situation I encountered as a nurse in healthcare setting. In healthcare setting, one of the following, I once encountered a situation where there was a miscommunication between the healthcare team members regarding a patient medication. So to resolve it, I facilitated first and transparent communication among them. And number 2 is to clarify the medication order. And number 3 is implement a system double check medication administration. This is to ensure patient safety and prevent similar incidents in the future. Another example I will give you is when dealing with difficult or agitated patient. It can be challenging to provide care to this patient and maintain a calm and professional demeanor in such situation. So nurses need, as a nurse, I need to use communication and de-escalation skills to address the patient concern and ensure their safety and well-being. Another challenging situation could be when facing a high patient load or a sudden influx or critically ill patient. So these are the mostly I encountered in my clinical experience before. So it can be overwhelming to prioritize care and make quick decision in this situation. So we need to use our critical thinking as a nurse and need to stay organized and collaborate with the healthcare team and manage their time effectively to provide the best care possible. These are just a couple of examples I can give you, but there are many other challenging situations that nurse face. So it is important for us as a nurse to have a resilient adaptability and a strong support system to navigate these challenges. So another question is with regards to ensuring patient safety and quality of care. So I, as a nurse, prioritize patient safety by following guidelines, adhering to the best practices, and consistently monitoring patient for any potential risk. I also promote a culture of safety by encouraging open communication with the nurse team and also for the patient, and reporting incidents and actively participating in quality improvement and initiative. It also involves us creating a safe environment and also implementing safety protocols and ensuring effective communication for us as a healthcare providers. So when you say quality of care, on the other hand, is my own focus on delivering healthcare service that met or exceed the expectation and need of patient. It includes aspects such as timely access to care, effective treatment, patient-centeredness, and a positive outcome. Other guidelines in ensuring a patient's safety and quality of care are the following. We have to solve problems. Solving problems, it will be less easier for us. We have also to making decisions and setting priorities and collaborating with team members. So these are the important things we need to do for ensuring the quality of patient care. So number 2 is identifying and bridging gaps in care that could place patient health at risk. So, number 3 is monitoring patient for clinical deterioration, detecting errors and near misses, and understanding care process and weaknesses inherent in some system, and also identifying and communication changes in patient condition. Other thing is monitoring a patient condition and identifying and reporting changes if there's changes in a patient condition, detecting diagnostic and treatment errors, and administering medication. We have also to building a relationship and advocating for patient in settings such as an hospital, doctor's office, and nursing home. Finally, I as a nurse are responsible for ensuring patient safety and quality of care. We play a critical role in monitoring patients, detecting errors, and communicating changes in patient condition. So, nurse staffing ratio and nurse sensitive indicators are important metrics for ensuring patient safety and quality of care. Another question is describe the approach for effective communication. I believe effective communication is crucial in healthcare. So, if there's effective communication, there's a good outcome. So, with patient, I strive to listen actively and provide a clear explanation and address their concern with empathy and respect. With other healthcare team members, I value collaboration, active listening, and clear and concise communication to ensure seamless coordination and delivery of care. So also, for me as a nurse, it involves a clear and concise verbal and non-verbal communication, active listening, and empathy. So when you say active listening help nurses understand patient needs and concern, fostering a trusting relationship. Empathy allows nurses to connect with patient on an emotional level, providing comfort and support. So, good communication for us nurses also involve using appropriate language, considering cultural differences. We should know that we have to meet different patients and utilizing technology effectively. So, by practicing effective communication, nurses can enhance patient satisfaction and improve outcomes and promote a positive healthcare experience. Other approaches for effective communication are listen compassionately. So we have to listen compassionately what the patient's telling to you. So you have to at least this is most important thing to do as a nurse, listening. And also another thing is be observant. So you have to observe the attitude, the environment, what are the things you need to observe. These are the things. And also adapt your communication style. Another thing is understand non-verbal cues. So and also another thing, be silent. Not always all the time you have to talk, so at least showing an attitude of silent, it means you're listening to the patient. And also recognize positive behavior. So when patient is talking, recognize his positive behavior. At least you have to at least tell him that the patient is doing good, like that. And also demonstrate acceptance. So not also by listening, but also accepting the patient or whatever circumstances that the patient telling to you. So you have to be you have to do an acceptance behavior. And providing a company. So not only giving the treatment he needs or she needs, but also by providing a company, it will be most helpful for the patient you are dealing with. And another question we have to answer is the most important qualities and skills for healthcare professional. So what are the important qualities and skills for healthcare professional? In my opinion, as a nurse, healthcare professional should possess qualities such as compassion, empathy, strong critical thinking skills, effective communication, adaptability, and commitment to a lifelong learning. These qualities and skills contribute to providing patient-centered care and adapting to the ever-changing healthcare landscape. Other important personal and professional qualities of a nurse include caring nature. We have also the empathy and passion. We have also the detail orientation. We have also the organization. We should be organized in dealing with this patient. Emotional stability. We should not be also attached of what the patient's telling to you. We should be have an emotional stability. We should have also the adaptability. And we have another thing is the physical and mental endurance. We have another thing is quick thinking and great judgment. Other thing is excellent verbal and written communication skills. We have also respect for human dignity in patient advocacy and truthfulness refined by tracking communication. So another thing I will answer question is, how do I handle stress and pressure? So we know nurses are having this kind of stress and pressure, especially in the work. If they are having there's a volume of patient, we have to give another medicine to this patient or the other patient. So we as a nurse is a fast-paced healthcare environment. So I manage stress for me and pressure by prioritizing tasks. So you have to prioritize according what the needs of the patient. Also, by practicing self-care and seeking support from colleagues when needed. So don't hesitate to ask for help when in needs, because we know by asking help it makes our work easier and manageable. I also find that taking short breaks, practicing mindfulness, and maintaining a healthy work-life balance as essential for managing stress effectively. And also important for me, spending time or quality time with my family. It also important in managing pressure and stress. It lessens my stress. It gives me a positive output, and it gives me strength when I'm with my family. So I will also give some other helpful tips to handle stress and pressure, especially as a nurse. These are the maintain a routine to alleviate anxiety, like yoga, exercise. Also eat healthy to boost energy, mental performance, and sleep quality. So this will help you to regain your mind, to lessen your stress also, and at least get at least 8 hours of sleep every night. We know some nurses, they're having overtime, or they're having a night shift duties, but it's always important to have an 8-hour sleep every night. And exercise regularly to lower stress. This is very much important also to improve our mood and sleep quality. We have to also to spend time in nature to lower stress hormones. Spend time in nature like doing biking, doing walking, like that. And other thing is practice setting healthy boundaries. And another thing to alleviate the stress is take a day off when stress levels gets too high. So we nurses, you have to at least take a day off, because they are telling money cannot buy your health. So we have to take care of our health always. Another thing is do not work more than 4 to 5 days without taking a day off to rest. That's an important thing also. And having a healthy support system is essential to mental health. What are these healthy support system? These are our family, especially for me, my health support system, my husband and my kids. If I go them with in the mall or in the shopping, it's stress free for me. And also at least take time to meet your friends, like that. Yeah, it will at least minimize the stress. Another question is with regards to collaboration with healthcare professionals. So as a nurse, we're collaborating with different healthcare professionals. So I have many instances where I collaborated with other healthcare professionals to provide comprehensive patient care. I can give you an example. One time, I worked closely with a team of doctors, pharmacists, together with my co-nurses to provide comprehensive care for a patient with diabetes mellitus. So we collaborated to develop an individualized care plan that included medication management, dietary recommendation, and lifetime modification. The doctors, they provided medical oversight and adjusted the treatment plan as needed, while the pharmacists ensured that the patient medication were appropriate and monitored for any potential interaction. And as a nurse, we implemented the care plan by monitoring the patient blood sugar levels and provided education and support also. So by working together, we're able to provide the patient with holistic care and help them manage their condition effectively. So collaboration is key in delivering the best possible care to our patient. So in terms of task prioritization and management, as a nurse, I use various strategies to ensure efficient healthcare delivery. So I start by assessing the urgency and importance of each task, considering the patient condition and needs. I prioritize also tasks that requires immediate attention, such as administering medication or responding to emergencies. I also delegate tasks when appropriate, making sure that each team members, is working at their full potential. Additionally, I utilize time management techniques such as creating to-do lists, settling realistic goals to stay organized and ensure that all tasks are completed in a timely manner. So thank you for taking time to listen to my mock interview. I hope you all are satisfied and happy with my interview, and I have really enjoyed this interview, and thank you for this time and listening. God bless. God bless. Thank you.